Okay, let's dive into this. Welcome to today's Explainer, where we're going to unpack a seriously fascinating medical mystery. Have you ever had that experience where you eat a great, satisfying meal and then suddenly your heart starts racing, or you suddenly feel like you literally can't catch your breath? It is a terrifying sensation, right? It sends so many people rushing straight to the emergency room, absolutely convinced they're having a heart attack. But what if the real culprit wasn't your heart at all, but actually your stomach? Today, we're exploring the incredible hidden connection between your gut, your heart, and your lungs. We're going to demystify something known as gastrocardiac symptoms.
You know, it's incredibly common to feel a massive wave of panic when your chest gets tight and your breathing gets shallow right after eating. And if you have ever felt this, let me tell you right now, the medical data completely validates your experience. It is absolutely not all in your head. That intense discomfort, the rapid heartbeat, that suffocating feeling, they are very real physical responses. But here's the twist. The origin of these symptoms usually stems from a perfectly normal, just kind of malfunctioning digestive process rather than a failing cardiovascular system. The relief really comes from understanding exactly what your body is doing in that exact moment.
To really get this, we've got to look at what medical science now calls the gut-heart-lung axis. See, we tend to think of our bodies as just a bunch of isolated systems, right? Like the digestive system is doing its thing over here, respiratory system over there, but the body's actually this intimately interconnected web. Think about it. When you experience severe bloating, gas, or you just overeat, your stomach physically expands like a balloon. And this expansion creates intense mechanical pressure in your abdomen that literally pushes upwards against your diaphragm. Now, since your diaphragm is the primary muscle you use for breathing, that upward pressure severely restricts your lungs' ability to expand fully.
Now, you might be wondering, okay, just how much can a bloated stomach actually mess with my breathing? Well, the numbers are honestly pretty astonishing. Studies show that extreme abdominal pressure from gas and bloating can reduce your lung capacity by up to 40%. I mean, wow, imagine trying to run or even just sit calmly on the couch while someone pinches off nearly half of your air supply. It makes total sense why this physical restriction triggers an immediate, full-blown stress response. Your body literally feels like it's starving for oxygen.
So this whole phenomenon actually has an official medical name. It's called Roemheld syndrome, or gastrocardiac syndrome, named after Ludwig von Roemheld. Basically, it describes a cluster of cardiovascular symptoms that are triggered entirely by what's going on in your gastrointestinal tract. And here is the neurological trigger for it. As your gut swells up from trapped gas or poor digestion, it can mechanically compress the vagus nerve. Now, the vagus nerve is essentially the communication superhighway between your gut and your brain. When it gets squished or irritated by a bloated stomach, it starts firing off chaotic signals to your heart. This can cause your heart to slow down or reflexively speed way up, which leads to those terrifying heart palpitations and chest pain.
And this brilliantly illustrates exactly how we can tell the difference between the harmless but totally scary pressure of digestive gas and the actual warning signs of a true cardiac emergency. Digestive bloating usually causes discomfort right in the upper or lower abdomen. It kind of spreads across the stomach area, and it's almost always triggered by eating a meal. On the flip side, true cardiac symptoms generally show up as sudden, severe pain right in the center or left side of the chest, and that pain frequently radiates out to the arm, the shoulder, the neck, or the jaw. Knowing this distinction is just so empowering, and it can honestly save you from a whole lot of unnecessary panic.
Let's move to and see how this builds from a root cause that you probably wouldn't expect. This mechanical chain reaction very often starts with something called hypochlorhydria. Now, that's just a fancy medical term for low stomach acid. We almost always think of stomach acid as the bad guy, right? The thing that causes heartburn. But hydrochloric acid is absolutely essential. If your stomach acid is too low, you just can't break down proteins effectively. So those undigested proteins just sit there in your gut, fermenting and producing massive amounts of gas. And boom, that gas buildup leads directly to that upward pressure on your diaphragm, kicking off all those terrible symptoms of Roemheld syndrome.
Now, what's really interesting about this slide is how clinical research clearly connects these dots for us. When we look at the symptoms associated with low stomach acid, the top indicators are things like bloating, flatulence, and a prolonged sense of fullness after you eat. These aren't just random annoying things that happen. They're actual clinical indicators that your stomach just isn't producing the acid it needs to efficiently process your meal. The logic here is pretty simple. If you fix the acid issue, you very often stop that excessive gas production right at the source.
But it doesn't stop there. Low stomach acid doesn't just cause gas, it actually sets off a whole cascade of nutritional problems.
Whether it's from chronic stomach issues, autoimmune conditions like atrophic gastritis, or even just taking acid-suppressing medications for way too long, a lack of stomach acid completely ruins your body's ability to absorb critical micronutrients. Think about it. Without enough acid, you can't absorb iron, which leads to anemia. You can't properly absorb vitamin D, which throws off your immune system. And maybe most critically for your heart rhythm, you simply cannot absorb vitamin B12.
And this brings us to a really sneaky hidden nutritional trap. See, your body is smart, and it stores a massive backup supply of vitamin B12. Because of that, it can actually take 2 to 5 years for those stores to completely run out. So you might be dealing with poor digestion for years before a B12 deficiency actually rears its head. And when it finally does, what are the symptoms? We're talking profound fatigue, dizziness, and, yep, you guessed it, chest pain and rapid heartbeats. So the very nutritional deficiencies that were caused by your gut issues end up pouring fuel on the fire, totally worsening the exact heart palpitations that triggered your anxiety in the first place.
But hey, the good news here is that you actually have a tremendous amount of control over this entire chain of events. Healing really starts with some vibrant, actionable lifestyle habits. First up, try going for smaller, more frequent meals rather than large, heavy ones. This stops you from overstretching that stomach. When you sit down to eat, try having your protein first, because that naturally stimulates acid production. Make sure you chew your food thoroughly and eat slowly so you aren't swallowing a bunch of excess air. And this is a big one. Stay upright after eating. Try not to immediately dive onto the couch to binge watch a show for a few hours. Let gravity do its job to assist your digestion and keep all that pressure off your diaphragm.
Right alongside those habits, making a few smart dietary tweaks can rapidly reduce that bloating and make breathing remarkably easier. You really want to avoid adding any extra gas to the system. So that means skipping the carbonated drinks entirely. It's also a good idea to limit high-fat fried foods and those complex fermentable carbs we call FODMAPs, especially if you know you're sensitive to them. Instead, you want to focus on supporting your gut microbiome. Add in some probiotic-rich foods like yogurt, miso, or sauerkraut. Oh, and definitely stay hydrated. But try to drink your fluids between your meals instead of gulping down water while you eat, so you don't dilute those precious digestive enzymes. So the crucial point we really want to drive home is this: our health is deeply interconnected. And that's not just true within our own bodies, from our gut to our heart, but also within our communities. We are happy if we are healthy and the people around us are healthy. Understanding the gut-heart-lung axis isn't just about managing your own digestion. It is knowledge that could literally save a friend or family member from totally unnecessary panic, endless worry, and incredibly stressful hospital visits. Sharing this kind of empowering medical information really uplifts everyone.
Which brings us to our final thought for today. Please like, share, and subscribe if you wish for a healthier friends and society. Like we just talked about, we are happy if we are healthy and the people around us are too. If you do so, only then will we reach more people and create more awareness about these easily misunderstood conditions. If you want any specific topic in the upcoming explainers, please comment below. Until then, I want to leave you with a question to think about. What other quote-unquote normal signals is your body sending right now that you might be completely misunderstanding? Keep learning, take care of yourselves, and we'll see you next time.